to a new video. Today we are going to start our new chapter of special pathology, that is heart, and the first most important chapter in the heart is heart failure. So if we talk about heart failure in layman language, so it is inability of the heart to perform its normal function. If we talk about its pathological definition, so it is pathophysiological state in which impaired cardiac function is unable to maintain an adequate circulation for metabolic needs of the tissues. It is the pathophysiological state in which cardiac function is impaired, maybe due to the ventricular failure, maybe due to the atrial failure, maybe due to some other problems. The tissues metabolic needs are compromised. When tissues needs are compromised and heart is unable to provide them an adequate circulation or adequate amount of oxygen, that is known as heart failure. So if we talk about its etiology, so in etiology there are two things, both are contributing to the heart failure. So number one is intrinsic pump failure. If ventricles are weakened, if ventricles are failed to pump, so that is intrinsic pump failure. And the diseases which can cause this ventricular muscle weaknesses, that is ischemic heart disease. We will talk about later in detail about all these diseases. Now, myocarditis, cardiomyopathies and arrhythmias. In ischemic heart disease, blood supply is compromised. In myocarditis, the health of the myocardium or health of the ventricular muscles is compromised. In cardiomyopathies, there is cardiac dilatation, that is also ventricular muscle weakness, and arrhythmias when there is imbalance between ventricular contractions. So we'll talk about in detail later. So the second factor which is important, which leads to heart failure, is increased workload. So when there is increased workload on the heart, that heart can't perform its normal activity. So increased workload, we divide it into two: increase in pressure and increase in volume. And the factors which can lead to increased pressure are third, that is systemic and pulmonary hypertension, valve disease and stenosis, that is restrictive cardiomyopathies. We will talk about it later in detail. And the second one is increase in volume. If you increase the volume of the blood, that ventricles can't cope with it. Ventricles can't have the ability to pump the excessive amount of volume of blood into the aorta, that is also heart failure. And the condition which can lead to the increased volume, that is severe anemia, that is thyrotoxicosis, and avitions, which are congenital disease. We will talk about them later. If we talk about heart failure classification, so there are few classifications. Number one is acute or chronic heart failure. Second one is left-sided or right-sided heart failure, systolic or diastolic heart failure, and the least important is forward or backward heart failure. Now we will talk about them one by one. So starting with the systolic heart failure. What is systolic heart failure? It is inability of the ventricles to pump enough blood into the systemic circulation for tissue perfusion. So what happens in systolic heart failure? First of all, starting with the basic physiology or the normal systolic function. As we know, the cardiac output is equal to the heart rate into stroke volume. Heart rate is beats per minute, and stroke volume is the volume ejected per beat. So if we take a heart rate is 70 beats per minute and the stroke volume is 70 ml per beat, this is equal to the 4900 ml of the blood ejected per minute. So this is roundabout equal to the 5 liter. So this is the normal systolic function. Now if we talk about the systolic heart function, for example, 110 ml of the blood is present in the ventricle, out of which 70 ml is ejected. So ejection fraction will be equal to the 64%, which is normal. Now what happens in systolic heart failure? For example, 110 ml is the preload, and out of 110 ml, only 40% amount of the blood or 40 ml is ejected during systole. So the ejection fraction will be less than 40%, which is a systolic heart failure. As we know, if the ejection fraction is below 40%, this is systolic heart failure. If it is above 40%, it can be systolic heart failure. up to the 50%, which is known as moderate heart failure, and above 60 it is the normal. So what happens in systolic heart failure? The ejection fraction falls below the 40%. This is systolic heart failure. Now, if we talk about the diastolic heart failure, as we know what is diastole, during diastole the blood fills up. Atria and ventricles both dilates, walls open, and they fill themselves up with the blood. Now what happens in the diastolic heart failure? It is inability of the atrium or the ventricle to fill enough. This is diastolic heart failure. Now what happens in diastolic heart failure? There would be decreased volume, total volume of the blood, as there is the diastolic heart failure, so there will be reduced volume of the blood, and therefore there will be reduced in the stroke volume. As if the amount of blood, if the preload is for example 70 or 69 ml, and out of which only 44% of the blood is ejected, so that is also 64%. So ejection fraction will be normal in diastolic heart failure, but the amount of blood is decreased, the total volume is decreased, and stroke volume is also decreased. So in diastolic heart failure, the most important distinguishing feature is decrease in the preload. The preload is decreased, so if the preload is decreased, so there will be less tissue perfusion. If the amount of blood reduced to 2 ml or 2.5 ml, there will be reduced tissue perfusion. So this is a diastolic heart failure when there is decreased in the preload. In systolic heart failure, the preload is normal. In diastolic heart failure, preload is increased. Now, to clearing the concept of preload and afterload. So what is preload? So preload, it is the end diastolic volume, or the volume of the blood which is present in the ventricles just before the systole. This is known as preload. And what is afterload? Afterload, it is the resistance offered to the ventricles by systemic circulation. So this is the concept of preload and afterload. So this is about the systolic and diastolic heart failure. So now we move on to left-sided and right-sided heart failure. So starting with the left-sided heart failure. If we talk about it, there can be systolic left-sided heart failure and there can be diastolic left-sided heart failure. So first we talk about the systolic left-sided heart failure. So what are the different causes of left-sided heart failure? So number one is ischemic heart disease. Ischemic heart disease, as we know, when the blood supply to any tissue or the blood supply to any organ is compromised, that is known as ischemic heart disease. And when there is reduced tissue perfusion, this is known as ischemia. So what happens in ischemic heart disease? There is less tissue perfusion, decreased oxygen, which can lead to the damage to the myocardium. Now, the ischemic heart disease is mainly due to the atherosclerosis of the coronary arteries. When plaque build up in the coronary arteries and the amount of blood which is flowing is reduced, causes the ischemia of the distal tissues. So when there is atherosclerosis, there is decreased oxygen supply, so there is systolic pump failure. The second cause of the left-sided heart failure is the systemic hypertension. When there is systemic hypertension, there is increase in arterial pressure. So there will be difficulty for the ventricles to pump against this high pressure, as it has to counter the afterload systemic resistance, and it is also have to pump against the high pressure. So there will be hypertrophy of the ventricles. So in result, when there is hypertrophy, muscle mass increases. So when muscle mass increases, there will be increase in myocardium oxygen demand. There is increase in oxygen demand of the peripheral tissues, and there is increase in the oxygen demand of myocardium itself. So there will be weaker contractions, and this can lead to the systolic heart failure. The third one cause for the left-sided heart failure is the cardiomyopathies. So what happens in cardiomyopathies? As there is increased pressure, increased volume load, increased pressure load, so in result, as a compensatory mechanism, the heart chamber dilates. When heart chamber dilates, there is an increase in preload, there will be more contractions. When increase in how increase in preload can lead to increased contraction, it is evident from Frank Starling law or the rubber band law. The more you stretch the rubber band with excessive force, it will be rebound, it will bounce back. So when there is increase in preload, there is stretching of the ventricular muscle wall. When there is increase in contraction, there will be more amount of the blood which is ejected by the ventricle, but over time there will be muscle weakness which can lead to the heart failure. So these are the few causes of left-sided systolic heart failure. Now, if we talk about the diastolic left-sided heart failure, so systemic hypertension is the number one cause of the diastolic left-sided heart failure. So when there is systemic hypertension, as we discussed in the previous left-sided heart failure systolic, so when there is systemic hypertension, there will be hypertrophy. When there is hypertrophy of the ventricles, for example, this is the normal ventricle. When there is hypertrophy of the muscle mass increases like this. So when muscle mass increases, there will be less volume for the blood. So when there is less space for the blood, there will be decrease in preload, which can ultimately lead to the diastolic heart failure. So the second one called is cardiomyopathy. We discussed it in the previous concept of left-sided systolic heart failure. There will be restrictive cardiomyopathy. What is restrictive cardiomyopathy? It can be due to the stenosis or the restriction for the flow of the blood. There can be stenosis of the mitral valve, there can be stenosis of the aortic valve, there may be stenosis of the pulmonic valve, there may be stenosis of the mitral valve. So this is restrictive cardiomyopathy. Now what happens, the most important concept in the diastolic heart failure is the pulmonary and the generalized edema develops. So how the edema develops in diastolic left-sided heart failure, as diastolic heart failure can cause pulmonary congestion. So how edema develops? As when edema develops, there will be decreased filling. In diastolic heart failure, there is decreased filling of the atrium. So when there is decreased filling, there will be tissue or the volume build up in the lungs and the peripheral tissues. So when there is decreased filling, there will be decreased tissue perfusion. When the less blood is ejected by the ventricle, there should be reduced blood flow to the kidneys. When kidneys blood flow is reduced, this will activate the renin-angiotensin system. So when renin-angiotensin system is activated, it causes the fluid retention. When there is fluid retention, there will be increase in preload, the volume build up. So when volume build up, here is the stage when the edema starts developing. So when volume build up in the pulmonary area, so there will be blood leaks out into the alveoli. So there is fluid build up also in the alveoli. So when blood leaks out, there will be the edema. When there will be volume of the blood in the pulmonary area, then this edema can also move up to the liver and cause hepatosplenomegaly. Spleen is enlarged and liver is enlarged. If the liver edema will be progress, if liver edema will be there for more than 1 or 2 weeks, there will be starting of the liver cirrhosis, can ultimately lead to the liver failure. So when blood leaks out into the alveoli, there are blackish cells in the alveolar blood, which is also known as hemosiderin cells. The blackish cells, which is also known as the sign of the heart failure, when there is blood cells present in the alveoli. So when generalized edema develops, there will be dyspnea, there is orthopnea. Orthopnea is a difficulty in the breathing when someone lies down, and there will be murmur and the abnormal sounds. So this is all about the left-sided systolic and diastolic heart failure. So now we move on to the right-sided heart failure. So first I am clearing your concept of heart failure. When heart fails, it fell as a whole, but for the sake of the pathology, we divide into right-sided and left-sided heart failure. So the first cause of right-sided heart failure will be it can be caused by the left-sided heart failure. Usually it is secondary to the left-sided heart failure. So what are the two different reasons? Other reasons which we discussed in the left-sided heart failure, also same in the right-sided heart failure, but in right side there will be addition of the two other reasons. So the number one reason which can be responsible for the right-sided heart failure is the congenital reasons. So in the congenital reasons, as we know, there is atrial septal defect, there will be ventricular septal defect, there will be ductus arteriosus, or there will be tetralogy of Fallot. So there will be, in congenital reason, there will be left to right shunt. For example, if we take this as a simplified version of the heart, so there is gap in between the atrium, or there is gap in between the ventricle, so blood moves from the left side to the right side. As we know, on the left side there will be high pressure. So as we know, the things move from high pressure area to the lower pressure area. So this is known as left to the right shunt. As in case of congenital conditions like atrial septal defect or ventricular septal defect, the pressure on the left side is high, so blood flow moves from the left side to the right side, from the high pressure area to the lower pressure area. So when there is volume, so there is in less pressure, the blood move from the left side to the right side, so there will be increase in fluid volume on the right side, which cause the hypertrophy. So when there is hypertrophy, there is less space for the blood, so there will be ischemia of the myocardium, and there will be the heart failure. So the second reason which can lead up to the right-sided heart failure is the chronic lung disease. So when there is chronic lung disease, there will be alveolar damage, so there will be less oxygenation. As we know, the less oxygenation leads to the hypoxia. So when there is hypoxia, pulmonary artery constricts. So when pulmonary artery constricts, there will be increase in pulmonary blood pressure, which causes heart failure, which also leads to the diastolic or right-sided heart failure. This is also known as cor pulmonale. So what is cor pulmonale? It is the lungs induced heart failure. So when lungs are the contributory factors, so when lung contributes towards the heart failure, this is known as cor pulmonale. So these are the two different conditions or two different diseases of the right-sided heart failure. So now the other conditions which can be lead to the heart failure, or the classification of heart failure, is the acute or chronic heart failure. In acute heart failure, there will be sudden and the rapid loss of function of the heart. So what are the conditions which can lead to the acute heart failure? Is the myocardial infarction, when there is decreased blood supply. And the most important contributory factor for this is atherosclerosis. What is atherosclerosis? It is the plaque build up. So the number one is myocardial infarction. Number second is the valve rupture. When valve rupture, there will be mixing of the oxygenated and the deoxygenated blood, and which can ultimately lead to the pump failure. The third one is emboli. Emboli is the most important cause of acute heart failure. What is emboli? It is the clot of the blood. Clot of the blood lodged in the pulmonary vein. The emboli can be lodged in the coronary arteries or coronary veins. The emboli can be lodged inside the heart in the ventricles or atria, can be lead to the acute heart failure. Now the last one is acute viral myocarditis. When there is acute attack of virus on the myocardium, there will be myocarditis and lead to the pump failure. So what are the conditions which can lead to the chronic heart failure? So in chronic heart failure, the number one is coronary artery disease. Long-standing coronary artery disease can lead to the chronic heart failure. Second one is systemic hypertension. Already we discussed it. The third one is lung diseases. We already discussed it in the previous lecture, or the right-sided heart failure. So the last and the important classification of the heart failure is there can be forward failure or there can be backward failure. So what is forward failure? So forward means when there is diminished blood flow of the blood to the tissues. When there is diminished flow of the blood to the tissues, to the peripheral tissues by the ventricle, is known as forward failure. So when there is forward failure, there will be decreased blood flow to the tissues, there will be reduced renal perfusion, there will be activation of renin and angiotensin system, which can cause an increase in blood pressure, and there will be improvement in the renal perfusion. So what are the signs and symptoms of forward failure? There can be cold extremities, and we can see shock in serious cases. The last one is the backward failure. So what is the backward failure? This is the congestion, or this is the volume buildup in the lungs. So when ventricles fail to eject, so when there is ventricle fail to eject, there will be increase in end diastolic volume. So there will be increase in volume and pressure. So the volume and pressure can cause venous congestion. As it is the We can diagnose the backward failure when there is jugular venous distension. So this is all about the heart failure. So thanks for watching the video. Hope you see in the next video. Thanks.